Wow, it's not even 10 o'clock and you guys are already fired up. Charlene, thank you so much for that introduction, and good morning, bonjour, buenos dias, SEIU. It's great, ladies and gentlemen, it is such a great pleasure to be here, to be invited to speak with you, and to share this podium over the course of this conference with so many people who inspire me, with so many people who share a commitment to reducing the gap between rich and poor, between working people and those at the top, with so many people who fight every day for justice, justice for workers, justice for communities who, whether it's in America or Puerto Rico or Canada, where I'm from, people who struggle to overcome the barriers of systemic discrimination that is pervasive in both our countries. With so many people who unite together for universal health care coverage, to reduce the number of uninsured and make our families and our nations stronger. And with so many who fight for immigrants to this country and to mine, who recognize and value their contributions to our nations, who fight to bring them justice, and who oppose the voices of hate, who would deny them their rights and tear families apart. Quite simply, you inspire me. With your voices raised together, with your unmatched record of organizing, of advocating, of lifting people up, you are SEIU. Across America, across Puerto Rico, across Canada, north, south, east, and west, you are 2 million strong, fighting for a better world. Now, I want to thank you for welcoming me today, and I think I'm the only Canadian politician who is speaking here at the convention this week. I know Prime Minister Justin Trudeau, and you know those pins are going for about $100 on eBay right now. I know Prime Minister Justin Trudeau took the time to record a video, and so did my boss, the first woman to ever hold the office of Premier in my home province of Ontario, Premier Kathleen Wynne. And as we've heard in their videos, the work of SEIU is well known throughout Canada. And we have all the members of Canada's very own SEIU Healthcare to thank for that. And in particular, I want to thank and recognize President Nelson and Vice President Bridger from Local 2 Ontario, and especially the President of SEIU Healthcare Canada, Charlene Stewart. Charlene, as you know, is a powerful voice for social justice and a trusted advisor for governments across Canada as we work to raise wages and improve access to health care for all Canadians. Charlene, thank you for inviting me to speak at this convention and for your constant advice, your common cause, and your advocacy on behalf of your members. Ladies and gentlemen, when Charlene invited me to speak, I thought, okay, I've got an idea. On behalf of Canadians, I'll come down here and see if the media reports are true. That with all the divisive political rhetoric in some US political circles, seriously, Donald Trump? Is it really true that you are all going to move to Canada if he gets elected? I don't believe it. But if it is true, I should be here to say what Canadians tend to say when people from other countries want to move to Canada. Welcome home. But then I thought, no, that's not SEIU. They're not moving to Canada. SEIU, these are the people who are going to work harder than anyone else, who are going to organize, who are going to knock on doors, make phone calls, get people registered, and then get out the vote to stop the right-wing dog whistling and give the people of America the first female president of the United States. But look, I arrived here in Detroit this morning after crossing the border from Windsor, Ontario. Detroit and Windsor have something in common. They're resilient cities. They're cities that, in the face of people telling them they've seen brighter days, those cities are defiant and hardworking. They see those brighter days ahead. They're cities that are experiencing a rebirth, led by communities of people who know it takes hard work to create real change. They're also cities that know what it means to be a good neighbor. And crossing the border this morning, I had a few minutes to reflect on what it means to be America's neighbor and its friend, to reflect on the many things we share. In both of our countries, the problem of income equality is one that is gaining increased visibility. And as that wage gap grows, as the middle class weakens, and as all the gains get concentrated on the few at the top, that makes our society less strong, and it makes our people less healthy. And as the Minister of Health in the province of Ontario, that's something I confront every day. It's something called the social determinants of health. It's all the things that contribute to making people and our communities less healthy. Things like poverty, unemployment or precarious work, racism, homophobia and transphobia, substandard housing, no access to justice. All those things make people less healthy, the social determinants of health. And one of the reasons I know that is because I'm a public health doctor. And thank you from that one person who. But when I graduated from medical school, as was mentioned, I practiced medicine all over the world. And in particular, those parts of the world that were and are ravaged by war. Places like Iraq, Somalia, Ethiopia, Sudan, and Afghanistan. And I could see in those countries how poverty and despair, along with so many other conditions, contributed to very poor health conditions and poor health outcomes. And so when I came back to Canada, with my spouse, Dr. Samantha Nutt, we founded an organization called War Child to help children and women right around the world. But I also practiced family medicine, which I still do to this day, at a small clinic that serves a population that is mostly poor, many of whom are new immigrants to Canada, who struggle with housing, who struggle to find jobs, and who work and work and work to make ends meet. Those are my patients. And for the healthcare workers in the audience today, I know they're your patients and your clients too. These are the people I think of every day when I come to work to improve access to healthcare. Ladies and gentlemen, I know that it's not enough to write a prescription and then send that person on their way. If they're going home to poverty, to unemployment, to substandard housing, to a situation where they have to choose between filling that prescription or putting food on the table for their family, they're not going to get better. No one ever should have to make that choice. So as we work to improve access to health care and affordable access to medication, might I add, we must also work to address these root causes, those social determinants of health. And that's why, as the Minister of Health, I want to thank you so much, so sincerely, for all your work on all these crucially important issues. And I'm here today to tell you that we are already seeing progress. And so much of that progress in Ontario is the result of my government's strong relationship with SEIU. It's a result of your advocacy, your advice, and as a politician, I've got to admit, time to time, sometimes your friendly pressure. And what you're doing is working, because in the province of Ontario, we've got an aging population. We've got a publicly funded healthcare system that is trying to evolve to meet the needs of our people as they grow older. And those changes, that transformation, it recognizes that people get better faster when they can live independently at home with the support of professional and highly skilled home care workers, just like the ones who are in this room today. Ladies and gentlemen, home care workers who are, without exception, well-trained, who are safe, who are highly competent and highly reliable. Home care workers who help their clients and patients recover from illness and live independently. And with the advice of SEIU, and in no small part because of your efforts, my government is raising your wages and improving your working conditions. We have raised the minimum wage for home care workers, or personal support workers as they're called in Ontario, and this year that wage is going up to $16.50, a $4 increase per hour from just 3 years ago. And it kind of makes that goal of a $15 minimum wage seem attainable, doesn't it? So that's good news for home care workers who too often were underpaid and taken advantage of. But it's also good news for healthcare in Ontario, because it means we're recognizing the importance of home care to our healthcare system and to people in our province, and we'll be better able to recruit and retain a skilled workforce of home care workers, like the ones represented by Charlene and SEIU Healthcare. So the steps we've taken to raise wages and reduce income inequality for home care workers is a big win for workers and patients. But it's just the beginning, and I know there's much more work to do together to bring fairness for the home care workforce and to meet the needs of patients now and into the future. So we want to work with you to bring more consistency, more harmonization to contracts in home care, so that all employers will have the capacity to provide the kinds of wages, benefits, and training opportunities that all employees should expect. And speaking of training, we've created a training fund in Ontario that provides $10 million each year to help home care workers to upgrade their skills. And we know that labor groups play such an important role in training. Charlene has told me that SEIU wants to play an even bigger role in that area, and I look forward to discussing this with my colleagues in government who are responsible for training initiatives, and to do that on SEIU's behalf. But ladies and gentlemen, our plan also calls for the development of an improved personal support worker registry, so that patients, family members, employers, and fellow employees have confidence that their home care workers are educated, trained, and qualified to provide the care they need when they need it. Now, I spoke a little bit earlier about the things Canada and the United States share, but we also have things we can learn from you. I know that here in America you already have a National Summit on Aging. It's an idea that Charlene and SEIU members have brought to us and we feel has a great deal of merit. So as part of our plan, we're going to start planning a similar conference for 2017 to bring together key health and social service providers along with seniors and their family caregivers and researchers and policymakers. We're going to create a forum to share experiences, ideas, and opportunities, all with an eye to building a network of integrated health and community support services that help seniors live independently at home. And there's no question that Charlene and Canadian members of SEIU Healthcare are going to play a key role in helping us put it together. I've also been hearing from Charlene about how some states use what's called a self-directed care model for home so that clients have more choice and more continuity in who their home care provider is, while creating a common employer for care providers. And we're moving forward in Ontario with self-directed care. And I want to take a serious look at the models here in the United States to understand how they work and what's best for our province and our system. I look forward to working together on all of these initiatives. The kinds of initiatives that improve the working conditions of home care workers, of SEIU healthcare members, not just today, but tomorrow. For years, the people of Ontario have benefited immeasurably from the partnership that we have formed with SEIU, the partnership between government and working people on the front lines. Together, we've achieved so much when it comes to healthcare, and I mean that not just in Canada, but in the United States as well. Your passionate advocacy, your ability to organize, and your willingness to work hard has brought about real and lasting change. So with your support and with your hard work, you have made healthcare more affordable and provided coverage, and let's not forget, hope to millions of uninsured Americans. But we all know that those gains are under threat from a Republican Party that would roll back the progress that you've made. But let me tell you, being in this room, hearing from SEIU members from across the country and across the continent, I have hope. And here's why. Everywhere I go, I keep hearing this one phrase, 3 words: I'm with her. Well, what does that mean to me? Well, where I'm from, I'm with her could be about a leader in Ontario. She shattered the glass ceiling and became the first woman Premier of Ontario. She raised taxes on the rich and raised the wages of home care workers. She's building a pension plan for all those workers struggling to save for retirement, but who do not have a workplace pension plan. She's making tough decisions so that we can put people to work with the largest infrastructure investments in our province's history. And she has said loud and clear that systemic racism must end and has appointed Ontario's first anti-racism directorate, because we know and we believe that the time for real equality has arrived. And she's launched a first-of-its-kind effort to reduce sexual abuse and violence against women, because it's high time society recognizes it's never okay. And she is Premier Kathleen Wynne. From retirement security for workers to action against climate change, for a greener and healthier future. She takes on the big issues of our time. But I'm with her could also be about two leaders of the SEIU, President Mary Kay Henry and SEIU Healthcare President Charlene Stewart. They are leaders that you can be proud of, and they are leaders that I am proud to know. I'm with them. And like Premier Wynne, they are taking on big issues, fighting for prosperity and justice, and side by side with SEIU members like you are an unstoppable force for progress. I'm with her. And by her, I mean Hillary. So ladies and gentlemen, let me join you, whether it's here in Detroit or back home in Ontario. I'm saying, we're saying, I'm with her. Je suis avec elle, estoy con ella. And let me join you in that fight for progress. Thank you very much. Good day.